My name is Erik Brodt, and this is Amanda, and we're excited to be back here again. Thanks for the invitation. We, just a quick story, we carry feathers with us, and this is a feather that was given to me by a mentor in my life. I don't know how old it is, and I know it was given to him by the very first physician who was Native who graduated from the Mayo Clinic. And so it was given to me to carry on this message and these voices, which are often not included in the healthcare system. So today what we're going to talk to you about is the Pathways into Health program in the Northwest Native American Center of Excellence at Oregon Health and Science University, and what we're doing to increase Native American voice in the health education system. People often ask me why you do this work. Right here, students like Lakita Molson. Every day I wake up and I'm inspired by the stories of the students that I've had the opportunity to work with. And few exemplify that as much as Lakita. She's a student who I had the opportunity to work with through kind of the continuum of her educational journey. Started when she was in middle school at a Indigenous Health and Wellness Day camp, and it progressed all the way through now where she's in medical school. And her voice is very different from others. She's from a zip code where people don't become physicians who are from the zip code. She has a voice that's very unique from other people. She grew up with challenges that I believe have made her stronger. And she was able to get through those challenges because she stayed rooted within her cultural identity, who she is, and the teachings of her community. It's where she comes from that made her able to achieve the things that she's done. She grew up with food insecurity, housing insecurity, yet she was still able to be a valedictorian of her high school. She was able to go on to college to be successful, and it's joining in that journey with students like Lakita that keeps me inspired and charged to continue this work. Real quickly about the state of Native inclusion in the US medical education system. This is a picture from the AAMC. It's a graph, and it goes from 1980 until 2013. And this shows the percent change in different groups by race and ethnicity in US medical schools. There's been a lot of great work that has been done to diversify the US health workforce. However, I'm not certain that it is always relevant to American Indians, and I think that this graph typifies that, where there has been an increase in every racial, ethnic group who's considered underrepresented and disadvantaged, with the exception of Native Americans. And the thing that's difficult for me is that it's accelerating rapidly right now. In the last 15 years, this has actually gotten worse. It's not getting better. There's been a 70% reduction in the number of American Indians who are applying to medical school now, and a 63% reduction in the number who are getting in, just in the last 15 years. And so I think to myself, like, how can we work to increase our voice in a system? AAMC recently put out a graph that shows like how many medical students are enrolled in the entire country right now. There's almost 90,000 medical students in all years. Just 200, just a handful more than 200 are American Indian. So there's so few of us, and these numbers are going down. So why is this happening? I'm not entirely certain why that's happening, but we have a model that we think is a way to change that, and that is through tribal engagement, school engagement, and making relevant, meaningful partnerships with communities to bring about the solutions that they need. There are approximately 148 medical schools in this country, and of those Native medical students who are in medical school right now, 50% of them go to the same 10 medical schools. And so my hope is that we can identify ways and provide solutions for the other 138 medical schools to also include and provide programming that's relevant to Native American people and Alaska Native people so that we can include our voice in the system. I think that what perpetuates this challenge is that there are not many Native American faculty. There's almost 170,000 faculty at US medical schools across the country. Again, less than 200 of those are American Indian, and only a handful are people who are at the associate and professor level, and so people that have a lot more voice are missing from that equation. So our solution is something that is a journey that we started a couple years ago at OHSU with partners from the region, and it just launched in July this year. We have partners in the Northwest Portland Area Indian Health Board and the 43 tribes of the Pacific Northwest, Oregon Health Science University, as well as Portland State University. And what we're doing is we're working together to create a model to increase Native voice throughout the continuum of education, starting very young and working all the way up to developing faculty and continuing to support and retain faculty who are American Indian Alaska Native. Our group is encompassed by two major teams. One is kind of the traditional educational core team, working on programs and curriculums, reaching back into schools as early as 10, 12 years old, as well as all the way extending into the faculty, like I mentioned. The other team that we have is a tribal outreach and research core team. These teams are composed of people from all different sectors of our partnerships. And I think what really makes it unique is that we've been able to create a balance in the system that we're putting forth in this model. We have 10 Native Americans who are paid on staff or faculty as part of this program. So we have Native voice from the beginning in our partnerships, as well as through all of the core teams as we move this work forward. The thing that I feel is most exciting about what we're doing is the tribal engagement component. That was at the heart of our program and what we're doing. And I'll let Dr. Bruegl talk about that. She's the director of tribal engagement at Oregon Health and Science University at the School of Medicine.
Thank you, Dr. Brodt. I too carry a feather with me. Last time I was here in the spring, I told a story of the feather that I received at medical school graduation, where one of my mentors told me, "You're a warrior now." And I am still that warrior, but today I bring a different feather. This is one that my now husband gave to me when he proposed to me. And he acknowledged the work that I want to do and carry through in my life. And so to me, it's a softer warrior feather for softer conversations today. To start this discussion, what I want to do is show a video of Trisha Patton. She is a pioneer in her community, and this video really embodies what we need to do when we engage communities.
This is our, what we call the highway to the villages, and we're going downriver to my home community, which is Napakiak. It's a little bit bumpy, but trail conditions are different every year. I wasn't aware of the need here in rural Alaska. You know, I did know that we did have the lack of dental care because growing up in the village, we had to travel to Bethel to get the dental care that we needed. But I didn't realize how important dental providers are, you know, how important DHATs are, especially for a region. The Alaska Native decay rate is 5 times the U.S. national average. Hi. Bethel and its surrounding villages total about 48 villages. A lot of these communities have never had a regular dental provider permanently stationed in their communities, and on occasion only have had a dentist visit their village once or twice within a whole entire year. My name is Trisha Patton. I'm a dental health aid therapist, instructor practitioner. Providing care into areas where there was a lack of dental care really motivated me. All right, just follow me. Growing up, we never had a Yupik doctor Never had a Yupik dentist. Thinking back, I could say, wow, that would have been really cool. And if I was little and if I did see somebody like that, I'm pretty sure I would be very comfortable. When my younger patients come in, or any patient, I speak to them in Yupik. And to me, that goes a long way, especially being someone who grew up in the village and being from the village. I feel like I have that opportunity to say, I'm just like you. And I could be that advocate. I could be that dental provider to give back to my people, especially knowing I'm Alaska Native and I'm there for them and for their community and our community, really. DHATs are a big plus in being a part of the dental team, especially for regions like ours, especially for villages with lack of access to dental care. Dental decay is something that can be prevented. Our children are our future, and that's who we start with.
I always get a little emotional when I see these videos. They're so powerful. So that was the world premiere here and now of that video. Thank you. So this video highlights what's so important about starting with the community and keeping the community from the beginning. This is a community that said, we have a need. We have a problem with prevention services. 2 times a year, they'll get a dental surgeon that comes in to do kind of treatment, but there wasn't a prevention effort. And many of us who've grown up in urban areas, we go to the dentist, get your teeth cleaned, you don't like it, you get told to floss, and then, 6 months later you go back again. But this community didn't have that. And most of us think that dentists are the only ones that do it. And this community thought outside the box and said, we can train our own community members to do this. And the Alaska Native Tribal Health Consortium, the Northwest Portland Indian Area Indian Health Board, and the Indian Health Service heard that and created this. And it's powerful. It's giving primary dental care all over the state of Alaska. And the state of Oregon just trained and graduated their first Native from Oregon to come back and start serving the people in the community. And so as we think about how do we move healthcare forward, how do we engage our communities in health, one of the first things we have to do with engagement is to stop and listen. We're all smart people here. We all have ideas. But if we just close our lips for a little bit and open the ears and listen to what's being said by the community, what's not being said by the community, what is the nonverbal language telling you, and start there, then we can start impacting change. Because if it comes from the community, we're more likely to be able to sustain something. When we're looking at Indigenous engagement, I think it's really important to look at some of the other factors. There's community, Americans living in the US with kind of similar upbringing, but there's also our very unique history. When you're working with a tribe and you walk into that tribe, it's good to know what's the history of your institution. So us coming from OHSU, we need to know who else has been there from OHSU, what else has been said, have there been good things, have there been bad things, what do I need to be aware of? Another thing to be aware of is what's the climate. There's many things in Indian country that are both good and challenging. In some of our areas, the suicide rates are really high. And so are you walking into a community that's in mourning? What's going on? I come in talking about dental care, and you have just lost a child in your community by their own hand. This is not the time or the place, right? So what's going on that you don't know about? There's also historical trauma. There's been a lot more about this information kind of publicly and in the news, but there has been a history that has been pervasive for many generations that impacted both my family, Dr. Brodt's family, and the community's families, where grandparents are sent to boarding school. Research has been done without consent. And so you have to be aware of that when you walk in, because you might not just need to be a good person and say, hey, I really want to do this good thing for your community, and you wonder why you get shut down. The other things with Indigenous engagement is Working with the tribal leadership. Tribes are sovereign nations, and we need to deal with tribes in that fashion. Very professional, acknowledging that there are their own laws and community rules that need to be abided by. And so as we try to move forward with our mission to help increase the number of natives in the health professions, we need to be aware of all of these things and ask our partners from the beginning. And so we are giving ourselves 2 charges over the next few years. We're going to go to the communities. There's 43 member tribes within the Pacific Northwest. And we're going to go visit the communities, talk to the stakeholders, talk to the tribal leaders, and just listen. What do you want? What do our medical trainees need to know to take care of the people of this community? How do we educate providers to be respectful? The other thing we're going to do is talk to the health people. Who are the foot soldiers on the ground at the clinics, and what resources do they have? Are there enough physicians? How many open job postings are there? Indian Health Service is chronically understaffed. You have a lot of locums people, so you have docs kind of coming in and out like a revolving door. What do you need? Who do we need to train? We've talked a little bit about physicians, and there's a physician shortage, but what about PAs? What about these dental health aid therapists? What about MAs? How do we meet the needs of the community? Because the people most likely to go back to the community are people from the community and serve. And so we have to help the community train what they want and what they need. I think the other thing that is important to remember is that we're not solving a problem, right? We're using our strengths and our resilience to enhance and elevate the health of the community. And so that is how we are coming in and working with the community, out of respect, out of them being the priority, and really acknowledging and elevating what already exists. We are just the conduits to help with any change that they want.
Thank you.